I'm Dawn O'Connell, the Assistant Secretary for Preparedness and Response. And for the past 17 months, I have led the Administration for Strategic Preparedness and Response, or ASPR, as Linda mentioned, where our mission is to help the nation prepare for, respond to, and recover from public health emergencies and other disasters. BARDA is a critical part of ASPR. For those of you new to BARDA, it is one of the premier research and scientific institutions in the U.S. government. I like saying that, so I'll say it again. It is one of the premier research and scientific institutions in the U.S. government. And BARDA is often an unsung hero, which is why I said it twice. It is always working tirelessly in the background. But I want to be clear that BARDA is responsible for many of the critical tools we rely on in times of infectious disease outbreaks and responses to other disasters. And under the strong leadership of Gary and Linda and their senior leadership team, BARDA continues to grow and innovate, and the country is better and safer and more prepared as a result. I am so pleased that BARDA has brought each of you here today to engage in what I hope are fruitful and challenging conversations about the future of medical countermeasures and the ways we might partner together. For those of you who have been with us from the beginning, you know that BARDA Industry Day has evolved, growing from local panel discussions in 2010 to bi-coastal educational meetings to now what is a large Washington, D.C. based conference. But still, the purpose remains the same. BARDA is focused on bringing together potential collaborators from across the public and private sectors who are interested in advancing the innovation and development of medical countermeasures. Bringing innovators together is an essential part of what we do in ASPR. We are focused on strengthening our nation's public health and medical infrastructure and building on the capabilities necessary to quickly mobilize a coordinated national response to disasters and emergencies. Coordinating these efforts with the private sector to accomplish this work has never been more important than it is today. ASPR is currently leading efforts to fight COVID-19, combat the monkeypox outbreak, ease the baby formula shortage, and we recently deployed personnel to Florida to help communities recover from Hurricane Ian. And in recognition of the important work the ASPR team, including BARDA, have been leading on behalf of the American people throughout the pandemic and every day, this summer, Secretary Becerra elevated ASPR from a staff division to an operating division within HHS. This puts us on the same footing as agencies like CDC, FDA, NIH, and others. This change allows us to build out the administrative functions, such as HR and contracting, that we need to fully support the responses we have been running. And we have a new name, and you see it up there, the Administration for Strategic Preparedness and Response. But to keep things simple, we kept the same acronym. We're still ASPR. And our work on COVID-19 is probably where we have crossed paths with many of you in the last few years. We have distributed PPE and other supplies from the SNS. We have shipped tests through covidtest.gov, and we have invested in domestic manufacturing of critical supplies to create a more resilient public health supply chain. And perhaps, most importantly, through its partnerships with you and many others, BARDA has led the research, development, and manufacturing efforts of COVID-19 vaccines and treatments. And we have ensured that they are available for free in communities across the country. We have also led a lot of innovative efforts and encouraged new ways of thinking about pandemic tools. One example is the BARDA Mask Innovation Challenge, which you'll hear more about from Gary in a few minutes, and he will share the details, but let me just say I've been impressed by the over 1,400 submissions we received. Consumer-driven innovation like this is what we need to continue strengthening our public health infrastructure. In addition to COVID, ASPR has been actively responding to the current monkeypox outbreak. From the first days of this response, we have been working closely with our CDC colleagues, coordinating the department's response and ensuring the availability of countermeasures across the country. And let me be clear, If it were not for the early support and investments by BARDA, the country, and the world for that matter, would not have had access to the Jynneos vaccine or the TPOXX antiviral to treat monkeypox. BARDA did this in collaboration with many of you, our industry partners, but I'm not sure that this message came out clearly enough in our response efforts, so I repeat this one as often as I can. Thanks to BARDA, we had a licensed vaccine to protect against monkeypox and a therapeutic available to those that got sick. We are in a similar situation with the current Ebola Sudan outbreak in Uganda. While there are currently no licensed vaccines or therapies for Ebola Sudan, BARDA has invested in the development of a therapeutic and 2 vaccine candidates that appear promising. BARDA is working closely with the government of Uganda and the WHO to set up clinical trials of the products to better understand their effectiveness in this outbreak situation. BARDA has also made small amounts of the therapeutic available to the Ugandan government under a compassionate use protocol to treat healthcare workers and young children. Each of these responses has been reliant on a portfolio of countermeasures that BARDA has invested in. In order to ensure that BARDA is investing in the right countermeasures against the right threats, I have relaunched the FEMC, the interagency body that reviews the current threat landscape and recommends actions on available or future countermeasures. I officially reconvened the FEMC in February, and it has met 4 times since then. I have asked them to review our smallpox strategy in light of the monkeypox response, our RAD-NUC, and ChemBio strategies in light of the war in Ukraine. And I have charged them with reviewing all 70 of our current countermeasure requirements to be sure we are investing in the right things in the right amounts. Many of these requirements haven't been updated in many years, even though our threat landscape continues to evolve. I'm pleased that this work has started and look forward to reviewing the FEMC's recommendations over the coming months. And we will continue to look for ways to engage with you, our partners, in this process moving forward. And with that, let me thank you all for coming and spending these few days with us. We understand that building a stronger, more agile system of preparedness means working closely with you, our private sector partners. I want to extend my deepest thanks to all companies, organizations, and individuals who have brought their technologies to BARDA for consideration. Simply put, we couldn't do it without you. Thank you for all that you are doing with us and on behalf of our country.